Okay, today what we're going to be working on is some temple volumizing. As we do age, I'll show you this real quickly to kind of show you why this works. As we age over the years, the fat in our face sort of redistributes. It technically ends up falling lower, and so the temple in your 30s here has a good amount of yellow fat. As we age over the next decade or 2 decades, you can see the loss of fat, especially in that temple area where there's almost none left. And what that does cause is this, what we call like a hollowing or skeletonizing of the temporal area. And you can see, it's above the cheekbone. It almost is like a little hollowing or depression there. And so what we're gonna do is just very easily kind of fill this little area in with today we're gonna use Restylane Lyft, but there's other ones that we could use in here. And it's a pretty quick and easy injection point here, which isn't very painful. It's not a real sensitive area. And so, okay, that was it. And so we're gonna literally put in almost the entire filler here, nice and slow. And you should see this area kind of volumizing here. We'll see it towards the end as it's all filled in. Can you feel or hear anything?
Nope.
Nothing?
Not a thing.
We're about to drop a whole thing in there. Go close to the whole thing, and then I don't know if you can see kind of below my syringe here, you can see this area filling in. One more. Sorry, sweetie. Good? So,
Wow, that was quick.
I still have just a quarter left. I might put in one more here. But I don't know if you can tell on the camera that we've lost some of that, and I will put just a little bit under here. Some of the lower aspect of it. And we'll just massage it in there. So that was literally 2 pokes. And I don't know if you can tell the difference now, but if you can see it from the straight on, she doesn't have quite the hollowing.
I can even feel there was a huge divot there. Now I don't feel it.
So that's it. I mean, it was, what, 2 minutes?
Yeah.
2-minute correction here. And this does help. Like when you fill this area in, you can see what it does to the lower jawline. You can see what it does to the cheeks and to the nasolabial folds. See how all that moves? So just by filling in the temple here can actually help that. And then we'll go do the other side.
I mean,
this side's not quite as bad.
yeah, I was gonna say, but even if you run your fingers and now fill each side.
Little pinch there, sorry. And maybe what we'll do then is use like 3/4 here, and I'll put the rest back in on the other side. Okay.
Why is one side depressed more than the other?
You know, it's a good question. That left side might be a sun exposure side. It may be related to sleeping,
I do
like
sleep
sleeping on that
I
side.
sleep on this side of my face.
But you can
more.
definitely tell like it's not quite as sunken in as it was when we first started. And then let me put one more little drop in here. Okay. And then we'll just take a little alcohol. I need a little gel too. Just to massage a little bit of your temples. So you can see it's not really hard, or you don't see any lumps or bumps in here. It's all just flattened, but it's definitely softened the contour here. And turn a little bit to the other side. Not bad, huh? We did both temples in a matter of 5 minutes.
Yeah, and it wasn't painful at all.
And hopefully we'll be able to get a good after picture of this now that we've gotten some befores, and you can see an immediate after improvement of this left temple.